Good afternoon. Thank you for joining us for Michigan's Stop of Protect Our Care's National Your Health, Your Vote virtual bus tour. My name is Diane Byram, and I am the State Director for Protect Our Care Michigan, and I will be moderating today's conversation. Protect Our Care is leading the fight to protect and strengthen the Affordable Care Act, which increases access to health care for millions of Americans. The November election is rapidly approaching. We're here today to talk about the impact the upcoming election will have on our health care and the ongoing attacks on the Affordable Care Act. For some, the election's outcome will be a matter of life and death. The ACA has been under attack by President Trump and his Republican allies for the last 4 years. And that includes the Republican-backed lawsuit to repeal the Affordable Care Act that is currently before the United States Supreme Court and threatens to snatch coverage from millions of Americans. On November 10th, exactly 1 week after the election, the Supreme Court will hear oral arguments in the lawsuit. Despite the ACA providing millions of Americans with life-saving protections, Republicans are still determined to overturn it with no plan on how to replace it. The Affordable Care Act is America's healthcare system, and without it, many Michiganders would not be able to access affordable, quality healthcare. In the past decade, the ACA has done a lot for Michiganders, including helped more than 720,000 people gain health coverage they can afford, reduce the cost of prescription drugs for seniors, ensure that Michiganders, including the 4.1 million who live with pre-existing conditions, have access to quality, affordable health care. It's allowed 73,000 young adults to stay in our state to stay on their parents' health care coverage. It's prevented insurance companies from charging seniors more for coverage because of their age, and it paved the way for Medicaid expansion by way of the Healthy Michigan Plan, which provides additional coverage for nearly 700,000 Michigan residents. We have an amazing lineup of speakers today, and we will hear their perspectives on the ACA. I'm joined by Congresswoman Elissa Slotkin, Dr. Farhan Bhatti, CEO and Medical Director of Carefree Medical in Lansing, Aisha Wells, a paid sick leave organizer with Mothering Justice, Tina Ray, a registered nurse and president of the Professional Employee Council at Sparrow Hospital and an affiliate of the Michigan Nurses Association, and Keith Van Houten, a patient advocate whose 21-year-old son has muscular dystrophy and relies on the Affordable Care Act for his treatment. Now I'll turn it over to Representative Slotkin, who represents Michigan's 8th Congressional District. Congresswoman, you have the floor.
So much, Diane. Thanks to everyone for joining us. I think we all knew that in some way healthcare was going to be on the ballot in this election. But after Friday night's news about Justice Ginsburg and her passing, I think it's more clear than ever that the impact of this election, as Diane said, will literally be life and death for some people. Just a week after our election, the Supreme Court, as Diane said, will hear oral arguments on the Trump administration's case to destroy Obamacare, and Justice Ginsburg, of course, will not be there. When I found out about Justice Ginsburg's death, I was eating some takeout around my dining room table at my farm on Friday night, and one of my youngest staffers gasped when she saw the alert on her phone and told the rest of us. And it's just a real shame that even in the moments after hearing the news, as we're thinking about what Justice Ginsburg did for our country, we're already thinking about the implications on so many other issues that are coming down the pike. What we could see really literally with this election is the concrete protections of the ACA replaced with these empty promises. And while the president says, and now his allies will repeat that he believes in protecting people with pre-existing conditions, they are literally at the same moment fighting to destroy them in court. And it is very important that whenever our colleagues on the other side of the aisle use this poll tested talking point to try and claim the high ground on protecting people with pre-existing conditions, we also ask them how they feel about this very court case, how they feel about the many, many times their party has voted to repeal and without a replacement the ACA. And to be clear, if oral arguments are heard and the court decides to invalidate the underpinnings of the ACA, gone will be protections for people with pre-existing conditions. Gone be caps on annual and lifetime out-of-pocket costs. Gone will be keeping kids on our health care until they're 26, like my stepdaughter was. And gone will be Medicaid coverage for thousands of people in Michigan who depend on it. And just to make this very, very clear, as a representative of the 8th District, I represent about 770,000 people. Our estimates are that 310,000 people in the district have a pre-existing condition. So you can imagine how catastrophic it would be if the case was repealed. Thanks to the administration's relentless attacks on the ACA, that is where we are. And of course, this is extremely personal to me. My mom passed away from ovarian cancer in 2011 after struggling with her health insurance for most of her adult life because she happened to have a pre-existing condition. She had breast cancer when she was a 31-year-old mom. And when she lost her job in 2002, she just simply could not afford the insurance that was on offer to her because they were just simply allowed to gouge her because of that pre-existing condition. So she went 5.5 years without insurance, without a checkup, without a gynecological exam, without someone saying, you had cancer as a young woman, you should really get checked out 6 months or have genetic testing or a hysterectomy. We finally helped her get insurance in 2008, and it was $1,000 a month and a $10,000 deductible. So her highest bill. In 2009, she let it lapse in the summer. And in the fall of 2009, she walked into an ER at Henry Ford and was diagnosed with stage 4 ovarian cancer. So that same week and month that we were dealing with that terminal diagnosis was the same week and month that we were investigating how to file for bankruptcy. So I certainly know what it means to have a loved one with a pre-existing condition live without care and the consequences of that. Yet the lawsuit that is coming up, barreling down on us right now, is literally poised to destroy those protections. And it will have real world consequences on people's lives. What we need to understand when you go to Washington, we need to be very clear where we stand on this issue because it is about people's children, people's parents, themselves, their life. It just means more than ever we have to be really clear with the people who we are planning to send to Washington. Listen, on the floor of the House this week, we are showing that we can still address issues in a bipartisan way. Literally right after this event, I'm running up to vote, and then we're announcing the passage yesterday of a huge, big package of bills, bipartisan, 10 Democrats, 10 Republicans, on a way to strengthen our national medical stockpile. The stockpile that we were so depending on right when COVID really walloped Michigan. And unfortunately, only a small amount of what we were expecting. Some of it so expired and so out of date was moldering. It's something that came directly out of our experience as a state that was hurt early on by COVID. And I wrote this bill because of nurses like Tina, who's on the line here, who were calling our phone lines incessantly in March and April, saying that they were sharing masks, they were sharing gowns, they couldn't get gloves, they couldn't get swabs, they couldn't get the basic protection that they needed in order to do their jobs. And as a national security professional, I really see that Tina and the rest of the frontline workers are the latest soldiers in America's latest war. And we sent them into battle without helmets, without body armor, without what they needed to protect themselves, even though we were asking them to stand in and protect us. This is as relevant as it's ever been because we see the numbers ticking up again across the country. We may be poised for a second wave. We need to make sure that our stockpile is replenished, it's transparent, and that it has what it needs to not only supply us here with the medical supplies, but also increase manufacturing of those same products here in the United States. It's a $500 million pot to start public-private partnerships so we can make that stuff in Michigan as opposed to in China, where we had such a hard time getting it out of. So on top of everything we're doing with COVID, we still might face a crisis for our families if we have the ACA protection stripped. And know that this is just not the right time to be re-electing and electing folks who aren't clear on where they stand on how specifically they'll protect people with pre-existing conditions. I know you're about to hear from lots of folks on screen. They can articulate it much better than I can, the real world consequences of these issues. It's not politics, it is real life, and it is quite literally on the ballot in this election. So thanks, Diane, and back to you.
Thank you, Congresswoman. I very much appreciate you taking time today to be with us and for sharing your personal story on healthcare and your stance in your work in Congress. I applaud you for staying true to your 2018 campaign promise to fight to ensure your constituents and all Americans have access to affordable, high-quality healthcare. Alongside your Democratic colleagues in Washington, you have fought tirelessly to protect the Affordable Care Act, and I want to personally say thank you. Now we're going to hear from Dr. Farhan Bhatti, who will talk about Carefree Medical and some of the benefits ACA has provided the patients he serves in Lansing. Dr. Bhatti, you have the floor.
Well, thank you, Diane, and good afternoon, everyone. My name is Dr. Farhan Bhatti, and I am a board-certified family physician. I have the honor and privilege of serving as CEO and medical director of Carefree Medical. Carefree is a nonprofit clinic located in Lansing that provides medical, dental, and optometry care to underinsured and uninsured individuals. Most of my patients have Medicaid or Medicare. Both Medicaid and Medicare remain under assault by President Trump and his Republican allies. President Trump and his allies have proposed steep budget cuts for both programs, which would kick millions of Americans off their insurance. If these attacks are successful and patients lose their insurance coverage, safety net clinics like mine across America may have to close their doors due to the loss of fee-for-service funding from Medicaid and Medicare. Those programs are a lifeline for millions of Americans, including my patients, especially as our country continues to deal with the COVID-19 pandemic. The Trump administration also supports the disastrous lawsuit, which will be heard at the Supreme Court 1 week after the election, which would overturn the ACA and thereby eliminating Medicaid expansion entirely. If they have it their way, the ACA and Medicaid expansion will be eliminated completely. Donald Trump's insistence on eliminating these programs is a travesty. Despite President Trump's 4-year war on healthcare, Medicare and Medicaid continue to provide coverage for tens of millions at a time, when the health and safety of so many Americans is at risk. If the lawsuit to overturn the ACA is successful, insurance coverage will be ripped away from more than 2 million Michiganders. It would also cut key funding from rural hospitals during the pandemic. This would mean reduced access to medical and dental care for children and families, women, people of color, seniors, people with disabilities, and people who live in rural areas. With so many people benefiting from these programs, the loss would be overwhelming. Let me explain why. Nationally, 39% of children have health insurance through Medicaid, and more than 6.8 million seniors have Medicaid coverage, as well as 40 million women and girls. Since the ACA was adopted, more than 680,000 Michiganders have become insured through Medicaid expansion. Why do Republicans and the Trump administration think that removing these critical, life-saving protections is a good idea? Ripping away these benefits from people would be devastating. I have seen firsthand how hard it is for the uninsured and underinsured to obtain the care they need to live healthy and productive lives. For my patients with diabetes, high blood pressure, mental illness, and many other conditions, losing their insurance will absolutely be a matter of life or death. While it's not perfect, the ACA has made great progress in just 10 years. We need political leaders who are willing to build on this progress, not leaders who want to scrap the whole thing. We can't afford to go backwards. The Republican attacks on Medicaid and Medicare must stop. The lives of millions of Americans are hanging in the balance. Thank you for being here today and to allow us to shine light on this important issue. And I'll toss it back to you, Diane.
Thank you very much, Dr. Bhatti, and thanks for sharing your perspective and insight on why Medicare and Medicaid are so important. I commend you for the work you're doing to keep people in Lansing safe and healthy. And thank you for your advocacy working with the Committee to Protect Medicare. Now we will hear from Tina Ray, a registered nurse, who will talk about how Trump's failed leadership made working on the front lines of the COVID-19 pandemic extremely challenging. Tina, the floor is yours.
Thank you, Diane. I appreciate being able to add my perspective as a nurse who represents fellow nurses who worked on the front line battling COVID-19 to this important conversation today. As a registered nurse at Sparrow Hospital in Lansing, I've been able to see firsthand how the president's failures to plan for the COVID-19 pandemic have impacted our healthcare system. President Trump refused to act early on when we knew the virus was coming, and he still has no concrete plan more than 6 months into the crisis. He has also admitted to downplaying the effects of the virus and refused to listen to public health experts. And that is just deplorable. This attitude has spread to his supporters, leading many to not follow public health experts who advise use of the stay-at-home when we're sick and to wear masks while in public. In fact, people were protesting without wearing masks near the hospital where I work a few months ago. I couldn't believe my eyes or wrap my mind around what they were doing. Downplaying the virus is offensive to myself and my coworkers, who are risking our lives to take care of patients suffering from COVID-19. Because of the president's failure to act, nearly 200,000 Americans have died from COVID-19, and more than 6.5 million Americans have been infected. We had an opportunity to slow the spread as a country, and we didn't act on it because of poor leadership at the top. This caused an influx of patients with COVID-19 coming to the hospital, putting a massive strain on our resources and limiting how much personal protective equipment was available for healthcare workers. We've done our best to make it work and save lives despite having very little help from the federal government. We need a president who will take a public health crisis seriously by listening to the experts who urge more testing, more PPE for healthcare workers, and a safe plan to reopen the economy. I want to thank Congresswoman Elissa Slotkin for her efforts to help our frontline healthcare workers secure PPE to keep us safe. Representative Slotkin's efforts are the type of leadership we needed to see from the Trump administration. We also need a leader who relies on science and the advice of the public health experts to make decisions, and who vigorously encourage the Americans to wear masks. Donald Trump is not a leader, and even more, his efforts to repeal the ACA could be disastrous for COVID-19 survivors. Because of the ongoing related health problems, COVID-19 can be counted as a pre-existing condition. That means that hundreds of thousands of people who've been infected with COVID-19 would not be able to access quality, affordable health care. While nurses are risking our lives and fighting for our patients, we need to know the president and the members of Congress, regardless of their party, are doing all they can do to keep us safe. We can't let Trump continue to wreaking havoc on our healthcare systems by electing him for another 4 more years. Thank you.
Thank you, Tina. And thank you for the sacrifice you make daily just to go to work. Now we're going to hear from Aisha Wells, who will talk about mothering justice and highlight the benefits the ACA provides women and mothers. Aisha, the floor is yours.
Thank you, Diane. My name is Aisha Wells, and I work with Mother and Justice. It's a nonprofit organization that empowers mothers of color to engage with lawmakers to act on a variety of issues that affect working families, such as affordable childcare, paid family leave, and safety net programs like the Affordable Care Act. The Affordable Care Act is critically important policy that has positively impacted the lives of millions of Americans, especially women and mothers of color. Over the last 10 years, the ACA has improved health outcomes for women across the board. As a mother of a special needs child myself, it is also why I am so passionate about fighting to make sure the ACA is not repealed. Eliminating the resources provided by the ACA possesses a major threat to important coverage that many women rely on to live healthy lives. Thanks to the ACA, 68 million women with pre-existing conditions cannot be charged more or denied coverage. Women cannot be charged more than men for the same coverage. Millions of women can access birth control with no out-of-pocket fees. Women can no longer face discrimination in healthcare settings, and nursing parents have breastfeeding support and critical workplace protections. The ACA has allowed millions of women to have expanded, improved healthcare coverage. In fact, the number of uninsured women in the US fell by nearly half in 2016. The ACA, through the expansion of Medicaid, has also filled gaps in maternal health coverage. This is good news for mothers and babies because it increases access to preventative care, reduces outcomes before, during, after pregnancy, and reduces maternal mortality rates. This has been specifically helpful in addressing persistent racial disparities in maternal health and maternal mortality, as Black women are 3 times more likely to die during childbirth than white women. Because of the ACA, Black women are more likely to receive care, increasing their overall health. Medicaid expansion also improved access to family planning services via the Healthy Michigan Plan. And many low-income women are better able to access birth control and family planning services because of Medicaid expansions. If the ACA is overturned, all of these key protections for women will be things of the past. Repealing the ACA would drastically dial back in the process the ACA has made on women's health care, especially women of color. We need leadership in the White House and in Congress that knows how crucial the ACA is to millions of Americans, especially women and all people of color. That means we need people who fight to protect and expand the ACA and not overturn it. Thank you so much, and thank you for having me be here.
Thank you, Aisha. And thank you for the important information you shared about how the ACA benefits women and mothers. For those that are joining, you can ask questions through the chat function, and when we conclude our remarks, we will take Q&A at the end of our comments. Now we're going to hear from Keith Van Houten, a patient advocate who will talk about his son and why the Affordable Care Act is so important to their family. Keith, the floor is yours. Thank you.
Thanks, Diane. Hi, this is Keith Van Houten. I live in Heartland, Michigan. And I want to talk a little bit about the ACA and how it affects my son, Kyle. I'm going to share a quick picture here so you can see who we're talking about. So hopefully you're seeing that now. This is my son, Kyle, in his dorm room at college. He's away at Bowling Green State University in Ohio. He's actually stayed home for the semester because he's high risk. He's immunocompromised. But this is him in his dorm here, and this is who we're talking about. So I have great employer provided insurance. I work for a large employer. I have terrific benefits. And the ACA has given me the peace of mind that I know I can count on those benefits until Kyle's 26. So that gives me 5 years to work with. But when you are dealing with a serious disease, like my son has muscular dystrophy, by the way, which is a muscle wasting disease. It's chronic and degenerative. It's fatal. So when you have something like that in your life that you're dealing with, you think a lot about the future. You think about the what ifs, the what whens. What if I lose my job? What when he graduates from college and hopefully he can work? Maybe if he does work, he won't have a traditional job. He won't have traditional kinds of benefits. What then? So Kyle needs to have insurance. And with the ACA under attack, I worry about how we're going to be able to get it. This pre-existing condition has an enormously high cost of care. He takes a single drug that costs over $90,000 a year. He gets around in a $45,000 wheelchair. He has other drugs. He's well over $100,000 a year in medical expenses, and that'll be for the duration of his life. This condition doesn't get better. We're the lucky ones, actually. I know people in the muscular dystrophy community who take a targeted gene therapy that was approved by the FDA fairly recently, and their costs are $1.4 million a year for the drugs. So for people with pre-existing conditions, with serious medical conditions, insurance is a must-have. There's no way anyone can afford to treat these on their own. I'd be bankrupt instantly if we didn't have insurance. And families like mine are exactly who insurers want to exclude from the insured pools. These high-cost patients, if you can exclude them and keep them barred from insurance, then it lowers your expenses, obviously, dramatically. So we're the kind of people that the ACA prevents insurers from excluding from their insured pool. They can't block us from coverage because we're sick. They can't drop us from coverage because we're costing too much. And the ACA ensures that we can get real insurance, even with a serious pre-existing condition. There's no annual or lifetime benefit caps. The plans have to cover required essential benefits. You can't have skimpy plans that don't cover anything. And we can't be priced out of insurance by charging us more than as a sick person than a healthy person. And these are all super important benefits to people that are dealing with pre-existing conditions and serious medical conditions. Now, if the Republicans succeed with their goal of overturning the ACA, families like mine with pre-existing conditions lose all of this. And like Elissa was saying earlier, they're all gone. This is all gone. It could be a little over a month that all this could be gone at the Supreme Court. And that scares the hell out of me when I look at this. What's even more disconcerting is the Republican approach that we're going to blow up the ACA, overturn it, and there is no plan whatsoever on how these protections will be replaced. You hear words from the Republicans that we're going to protect people with pre-existing conditions. Where is it? Where is it? We're a little over a month from the lawsuit being heard in the Supreme Court. And when the decision rolls down, what are we left with? Nothing. There's nothing out there. This approach is irresponsible and reckless. And families like mine, we can't just hope that things are going to be okay, that the law is going to be overturned and that things will work out. That's not how you live your life when you have a serious medical condition. Hope is not a plan. So that's all I have to say about this. Thanks for listening. Back to you, Diane.
Thank you, Keith. And thank you so much for sharing your family's personal story about the Affordable Care Act. I know it's difficult, but it does put a human face and it explains what families are going through. And I agree with you. Hope is not a plan. And thank you to all of our panelists today for giving up your time and participating. I want to draw attention to this document. It's the Michigan Guide to the 2020 Healthcare Election, Your Health, Your Vote. This is available on our Facebook page. So it's Protect Our Care Michigan. It's also available on Twitter, Protect Care Mich. So if you'd like to get a copy of that, please go to those two sites and you'll be able to download that. And at this point, this concludes our press conference. We will now open it up to members of the media for questions and answers. I know that Congresswoman Slotkin is in session today. There is floor discussion and votes. And so if you have a question specifically for the Congresswoman, we will entertain those first. So any questions from the media? Rebecca, I'm going to turn it back over to you to handle that portion of our agenda.
Thanks, Diane. The first question is for you, Congresswoman Slotkin, just asking you to talk a little bit more about this bill that you are working on today. And you're on mute.
I'm sorry. I always tease people about that, and then I do it myself. So we are announcing it's actually a package of bills, and it's on strengthening our national strategic stockpile. It is, like I said, fully bipartisan, and it does a number of things. First of all, it creates transparency on what the heck is in our stockpile, right? We didn't have a great sense of what was actually in there, both in terms of diversity of items, but quantity. It allows a mechanism that currently doesn't exist for the folks to refresh what's in the stockpile. We got our portion of the stockpile here in Michigan. There was stuff that was dated back 10, 15 years from the H1N1 outbreak and a bunch of other things, a lot of expired things. Well, you have to give the folks who manage the stockpile a way to sort of identify that stuff is come and due, and they've got to sell it off to other federal agencies, use that money to replenish the stockpile. We need to allow states to set up their own stockpiles if that's what they want to do. In Michigan, that was something that our governor is definitely interested in after our experience here. And then it sets up this $500 million basically pilot program, which would allow the federal government to go to American manufacturers of both medical supplies and pharmaceuticals and say, hey, we want to create a joint venture with you on an additional production line. It's something that, frankly, we used to do all the time at the Department of Defense, where we don't make our body armor in other countries. We don't make most of our military hardware in other countries because we never wanted to be beholden to another country if we had to mobilize for war. So we co-invest in production lines so that if we needed to surge on body armor, if we needed to surge on meals ready to eat, we could do it. We already were invested in that extra production line here in the United States. And like I said, I see and the other nurses and frontline healthcare workers as literally the front lines of America's latest war. So why not take the same concept and apply it to the civilian portion of our government, right? To the non-military portions. And I'm going to spend the next month in the district visiting different companies who could directly benefit from that $500 million pilot program. And the idea is, frankly, it mixes my national security life with Michigan manufacturing. There are just certain supply chains that have national security importance. They're not like making Rubik's Cubes. Let's keep making Rubik's Cubes in China. No one's life depends on a Rubik's Cube. But if you can't get a 78-cent mask into your nurses when you need it, that is a threat to Homeland Security, to our national security. So I want to treat it as such. First start with medical supplies and pharmaceuticals, but there's a whole longer list that I think was really exposed during COVID in March and April. So that's what we're talking about, along with my co-sponsor, Susan Brooks, a Republican from Indiana.
Thank you.
Thanks. Our next question is for the healthcare providers on this panel. Are you seeing long-term side effects for those who have suffered from COVID? And more general question, will those people now have, does that count as a pre-existing condition now once they've recovered?
Dr. Bhatti, you want to?
So The second part of that question depends on how the insurance companies interpret pre-existing conditions, but it certainly could be a possibility that the harm that's happened to patients from COVID, they might consider it a pre-existing condition and make it more expensive to insure those people if the ACA were repealed. So that's absolutely a possibility. With regards to long-term effects for my patients, I do have patients who tested positive for COVID who are still experiencing shortness of breath months after having, quote, recovered from their illness. And so that shortness of breath is concerning because we don't yet know all of the long-term ramifications of COVID-19. And there certainly is a plausible theory that at least some segment of the population that gets COVID-19 may end up with what's called pulmonary scarring. And so I'm concerned about that. And so people who continue to have shortness of breath symptoms, especially people who didn't have appreciable lung disease before they got COVID, it may be more expensive to insure those folks under a scenario where the ACA is repealed.
Thank you.
And our final question, is there any legislation at the state level or the federal level to bolster consumer protections if the Supreme Court does strike down the ACA?
Congresswoman, do you want to?
Sorry, can you say that one more time?
The question was, are there any legislative efforts at the state level or the federal level to bolster consumer protections if the Supreme Court does strike down the ACA?
Well, in my short time as a member, we've voted 5 times at least in different, forms to try and push back against this lawsuit and then defend protections for people with pre-existing conditions. And sometimes it was just a clear statement, we want to send lawyers to go push back on the lawsuit. And sometimes it was the next iteration of the attack on pre-existing conditions, particularly junk plans and the president's decision via executive order to extend these short 3-month plans that allow people to be, gouged for their pre-existing condition. He extended them to up to 3 years. And doctors and nurses from the 8th district were coming to my office in DC saying, people are coming in and they don't know that they're not covered for prenatal care or for birthing services. And we're having to tell them because these junks are now out there. So we voted 5 times. I mean, obviously, we have all been talking as recently as today on a Democratic caucus call about what our options are should the protections be overturned. There are legislative options. There are, attempts again through the courts, but all of this really depends on what happens in the November election. Our ability to either play defense or offense, our ability to really play man on man or zone defense is all determined by who wins what in November. So I can't put my best foot forward as a legislator unless I understand who's going to be in the White House, who's going to control the Senate, who's going to control the House, which is why we keep using this phrase that, our health on the ballot. It's not just a slogan. It is a legitimately real circumstance. And obviously, if Joe Biden wins, we have a possibility to do what we all want to do, which I think is go on the offense on not only protecting people with pre-existing conditions, but also dealing with some of the things that we want to change and improve about the ACA, right? No one thinks the ACA is perfect. But right now, it's just been constant defense, series that we've, and there's options, but they really hinge on November.
Thank you. Rebecca, does that conclude our questions?
Yes, that was it.
All right. Well, one more time, I want to say thank you to our panelists. Thank you, Congresswoman Slotkin, for not only joining us, but for all of the hard work you do every single day to protect the Affordable Care Act, to strengthen it, to stay true to your campaign promises in 2018. I know healthcare is very personal to every one of us on today's discussion. So thank you very much. One more time, I want to draw your attention to Michigan's Guide to the 2020 Healthcare Election. You can find it on our Twitter at Protect Care Mich, or our Facebook page, Protect our care, Michigan. So with that, I want to say thank you very much and have a great day to everyone. Goodbye.